Erectile dysfunction is classified as an inability to maintain an erection long enough to complete intercourse, and it can be a sign of severe underlying disease. Causes of erectile dysfunction include cardiovascular disease, hypertension, elevated cholesterol, benign prostate enlargement, obesity, smoking, and alcohol. It is important for us to understand that psychological factors also play a role in sexual functioning and erections. Stress, depression, anxiety, especially performance anxiety, a psychological dependence on erectile medication, and a lack or loss of interest in a relationship will have negative impacts on the quality of your erection. Today, we have treatments that restore functioning, blood flow, but we need to understand that lifestyle modifications play a significant role for a favorable outcome. Here at the T Clinic, we offer a holistic approach to sexual functioning, looking firstly at the root cause of your erectile problems and then addressing them specifically. Usually a combination of hormone balancing and optimization, platelet-rich plasma as part of rejuvenation, bioelectrical stimulation, the use of certain peptides, neuromodulators, as well as prescription medication. If you battle with a decrease in sexual functioning as well as in erections, feel free to contact us at the number below.